Hi guys, this is Dr. Seda again. So today I'm going to be talking about one of the things that affects people the most and affects their quality of life, and sometimes they have no clue. They go to their doctors and a lot of the times there's no answers. We don't know what's going on. We tell them, hey, I don't know, you should sleep more, and you're too stressed out. But in reality what's going on is that you're fatigued or you're very tired because the adrenals are not working so well. So what are the adrenals? The adrenals are two glands that actually are like the kidney hats. They sit on top of the kidneys and they produce dozens of hormones. Now they're in charge of a lot of things in our body, and when the adrenals are low, there's a laundry list of symptoms that you're going to have because the adrenals are low. Okay, one of the main things is going to be energy. You're not going to be able to make that much energy. You're going to be tired. You're going to sleep throughout the night, maybe, if you do, but in the morning you feel like you're not rested, like you didn't recuperate or you didn't recover. Sometimes you're just tired and dragging during the day. At night you get this surge of energy. Sometimes you're very, very tired and you cannot fall asleep, which makes no sense to a lot of people. In many cases, we're just going through the issues and we don't know why it's going on. We're getting belly fat and we don't know why. Our sugar is going up because we're making sugar, because the adrenals are affected in many cases. So all those things are going to be key for us to know so we can actually heal the adrenals and then move forward. Now sometimes the adrenals, it depends on the person, but it may take anywhere from 3 months, 6 months, up to 2 years to get the adrenals back in track. Now in general, the way that we do things, it just takes much less time. So in a matter of typically 3 months is a good time frame for a lot of people to at least notice a big difference in terms of how things are going with the adrenals, as long as you do certain steps. Okay, so the first step to heal the adrenals is going to be to avoid what caused the adrenal fatigue in the first place. The other name for adrenal fatigue is adrenal hypofunction. And one of the problems is that doctors are not checking for this, so they don't know, and you may have it and you're just not aware. There's a couple of tests that we can do to find out. We can check cortisol levels, we can do a DHEA level, and those things can give us a pretty good idea about where the adrenals are. Now, in terms of what things that cause the adrenal fatigue in the first place are stressors. Stressors to your body, not only psychological stressors, because you may have all this stuff going on, and in the past we had the fight or flight. Let's say that there's a saber-toothed tiger, and back in the day we were cavemen and we were just in the grass, just whatever we did back in the day, and a saber-toothed tiger comes and suddenly boom, your adrenals kick in and you get this surge of energy, and your blood goes from all the places that it was, like the stomach and extremities and things that are not right now the main important thing. Your body wants to right now be able to run and survive. So how are you going to do that? Well, the first thing is you're going to do is, like, when the adrenals kick in, you start making sugar so you can run, and you take the blood out of your gastrointestinal system and other areas that are not needed to take it to the brain, the heart, and the muscles so you can run. Now the problem is that right now in our society we are stressed out, but not because we have saber-toothed tigers. It is we carry the stress with us, right? So if you have kids, if you have parents, if you have a spouse, if you are driving, if you have bills, if you have a boss, if you have that evil boss, all these things that happen in our lives that we cannot run from. They stick in our head, and it's a big issue for a lot of people. So you need to try to manage that stress the best way that you can, and we're going to teach you a couple of things that you can do for that. But more than anything, it's also the stress that your body goes through, not only psychological, but the physical stress. So it might be, for example, if you're not sleeping well, that's going to deplete your adrenals quite a bit. If you have chronic infections, that's a big factor for adrenal fatigue, and viral infections a lot of the times is one of the causes of that too. Any gut issues, if your gut is not working well, that is going to affect tremendously your adrenals too. So all these things, we need to take care of that. Certain nutritional deficiencies, the wrong foods, all those things play a role. Okay, so we need to get off of the things that that cause it in the first place. Now second, I would say the second step would be to avoid what's worsening it. Sometimes it didn't cause it, but it may be worsening your adrenals. So one of those things are going to be coffee, any stimulants. So a lot of coffee, people that need coffee to survive, those people tend to have an issue with adrenal fatigue, and you're stimulating, you're pushing further. You're squeezing those adrenals, and at some point they're just going to crash. And now the coffee's not going to work anymore, and you keep escalating, and it's just not working. So sometimes we need to avoid stimulants as much as possible to actually get much better results in terms of our adrenals, okay? Now, another thing that you might want to know is, the step 3, let's say, is going to be food, okay? You want to make sure that you're taking the right kind of food to feed your adrenals, and the right timing. Some of the things that your adrenals need in general, I mean, they need some good source of sodium, not sodium that is just added to your diet, but the sodium that comes in certain vegetables and, even pink Himalayan salt. Some people put a pinch, and you can do a mix of maybe a teaspoon of pink Himalayan salt in a gallon of water, and you can mix that, and that would be the water that you're drinking, and that's something that can definitely help. We give enough sodium and electrolytes, because you want to have a good amount of potassium too, and then you want to have good sugars. When I'm talking about sugars, I'm talking about fruits, not table sugar, not fake sugars, fruit sugars that are just in the fruit, not the juice necessarily, but just eat the fruit, okay? The more berries and fruits and dates and things that you eat that are actually high in those sugars, but good sugars that are absorbed very well and your body utilizes them, is going to be better. It's better to be grazing and kind of like just eating every couple of hours a little bit of something, just to make sure that your adrenals don't have to start making that cortisol to make more sugar if your sugar is dropping down a little bit, which happens with people that have insulin resistance quite a bit, okay? Now, another thing that you want to do is you want to follow your body, okay? So, in general, our body is going to tell us, hey, this is not working for me. Sometimes you might be feeling very good. Oh my God, now I've got energy, I'm doing better, and you go ahead and you overdo it. And you go and you do a workout of an hour that you're not used to, and then you crash, and then the adrenals take a hit, and it takes a while to get back. So in reality, you need to just follow your body and just be very gentle with the things that you do if you have severe adrenal fatigue, and then just keep building up from there. Just don't overdo it. Don't be too excited about doing extra things that really, you might not need, okay? Another thing that is going to be important is to optimize the body in general. You want to optimize your immune function so it can fight those chronic infections. You want to alkalinize your body, and make it more alkaline so a lot of the processes work better, and you want to in general have the nutrients and all those things that your body needs to just get better, and bottom line, we're trying to decrease cortisol and make the adrenals go back and follow a very good rhythm, okay? And there's some supplementation that actually can be very, very helpful. There's some, one of the main of all the things that you can do for the adrenals, one of the main things is called adaptogen herbs. And adaptogen herbs are herbs that have the capacity to help the body adapt to different stressors. So it can help with energy, but it can help also with sleep. And it's kind of interesting how it has dual actions, sometimes opposite actions. It depends on what's going on with the body. There's several adaptogen herbs that you can, look into. Ashwagandha is one of the main ones. You have the holy basil, you have cordyceps, you have rhodiola, chisandra. There's several ones right now that you can actually have access to, and those might be very good to help with the adrenals. The other thing that you want to do is you want to have a active B complex. Typically active, meaning methylated. Some better B vitamins, that's going to help the adrenals quite a bit. Sometimes vitamin C is something also that can help the adrenals. In some cases, people take some adrenal extracts. In other cases, we can do something like DHEA, which is a hormone, or pregnenolone. All those things together, depends on the case, can help your body get back in track and get those adrenals back in track. Managing stress is going to be key. And I cannot stress that enough. If you don't manage the stress better, it's going to be very, very hard for your body to get back from adrenal fatigue. So in terms of managing stress, there's different strategies. There's a breathing technique that I'm going to be showing in another video that is called the 4-7-8. And it's a breathing technique that, I'll show you, and it's pretty simple to do, but it shifts your system from the fight or flight, like there's a saber-toothed tiger, to I'm relaxed. And that's what you want to be. Because when you are on the fight or flight or stressed out, you are in breaking apart mode. You're in catabolism. It means that your body is breaking. What you want to do is you want to be on the I'm relaxed, in which you're repairing and you're building, okay? And that's a very different thing. And sometimes that's why people that are stressed out or have adrenal fatigue, you can look at them and you almost know. You look at their skin, their face, the way that they walk, a lot of the things, and I can know if somebody has adrenal fatigue sometimes just by looking at them, okay? So in general, what are the steps? Let's go ahead and recap real quick. First, stop whatever causes the adrenal fatigue, okay? Second, make sure that you're not doing things that are worsening your adrenal fatigue. Third, the food. Frequently, the combination of the good things. You want to do also good fats like coconut oil and avocados and olive oils, and a lot of the good fats. That's very good. Protein, good sugars, which is really fruits more than anything, and your veggies, okay? Now the other thing that you want to do is follow your body. Don't overdo it because it's going to take you a while to get back. Just follow your body and go slowly. The last thing is just to make sure to optimize your system in general, your body in general. You want to have all those key things together, so then your body is the one that is going to be fighting those, viral infections like Epstein Barr Virus, EBV, or some of the ones that actually have been linked to chronic fatigue. You're going to be getting the nutrients back up. Antioxidants are going to be key. So I mean, all those things together are going to be good. Now, in terms of the anxiety and the stress, a lot of the times things that can help also are going to be essential oils, and those, there's the therapeutic grade. I wouldn't recommend, anything that is necessarily store-bought because of the quality might be very poor. But for the most part, if you have a therapeutic grade essential oil that can help with manage stress and sleep better, like lavender, sometimes they're just combinations. One that we use at home is called Serenity at night, and it works very well. Another one called Balance. I mean, we need to see which one is going to be better for you, but it's going to be one of those things that actually can make a huge difference, okay? So by putting all of that together, then your body's going to have the chance to give the adrenals a break and start repairing, because your body's going to be the one that's going to be repairing. So thank you, and hope that your adrenals get better.